Mr. Prabhjot Singh, Mission Director, NHM, Department of Health and Family Welfare, Government of Haryana. Thank you so much, Mr. Prabhjot Singh. Thanks for joining us.
Thank you for inviting me. I thank APAC for inviting me as a guest speaker. I was just listening to my colleague in Kerala, and I completely agree with his views. Uh, can I start?
Yeah, sure.
Yeah, thank you. So the topic of discussion is that how technology is playing a vital role in improving the public health landscape, especially beyond pandemic, the way forward. So since last almost 1 year or probably more than that, we are dealing with the pandemic. So first of all, thinking beyond pandemic is really a big question as of now. With respect to pandemic, I would like to emphasize that the technology has played really a vital role in strengthening our systems. For example, in Haryana, when the COVID started, then Government of India gave us a portal that is called S3 portal, COVID portal, in which the Government of India requested us to enter all kind of infrastructure details, what kind of infrastructure we were having, and we entered the details, and we got to know what kind of infrastructure the other country states, the other states or UTs are having, and how we are comparing with them, and what preparations do we need to have. Further, when we started doing house-to-house survey or using ASHA workers, we have 20,000 ASHA workers. Then we developed an app that is called ASHA Survection App. That was an outstanding app for which we got a Chief Minister award also. ASHA uh, ASHA surveyed all the people of Haryana 4 or 5 times using that app, in which they found how many people are having symptoms of COVID, and then we tested those people, and then we we found that the people who have come from abroad or who have contacted the positive people, and thus the technology has played a vital role. Similarly, I would like to emphasize upon another app that Haryana developed during the pandemic, but which we are thinking, or which we know, which we are sure that this will go beyond pandemic. That was regarding ASHA payment app. That was for the payment of ASHA workers. So we developed an app on which they put their activities, and then A&M verifies it, and then it goes to medical officer, and then it goes to account department, and then the payment is going directly to the account of ASHA worker. This was a long pending demand, but we were able to get the success, probably because of COVID, but this will go beyond COVID. Another thing, and that was started immediately after pandemic. That was the 1075 helpline. It may seem very small thing when we think of, but when the COVID pandemic, when the lockdown was declared during these days last year, then everything stopped wherever it was. All the activities, all the economic activities of all kind of people were stopped, and people were having apprehensions of all sorts. Then they needed something from which they can get reliable information, because humor market was also very hot. So we developed a 1075 helpline. That was a national helpline, but we developed a specific dedicated call center for this, and that helpline was used not only for COVID people, for the COVID issue. That was also used for distributing food grains for the people who are in distress, or all kind of other help that people needed in these kind of times. So 1075 helpline was really very useful. We also interacted with other state governments. For example, we interacted with Karnataka. They were using some excellent technology apps. We got to know their apps. We found what kind of apps they are using, how they are using GIS based technology, and we also implemented same kind of technology in Haryana apps. So probably we found that on technology we are on the same pedestal as the other countries. Probably we are a bit ahead of others. But when it comes to the cost part, then I would agree with my counterpart who has just spoken that technology should be something which should be accessible to all. It should not be a very costly kind of technology. It should not be prohibitive in the sense that only richer people can buy it. It should be something which the common man can buy, and which the government also can afford through its infrastructure, through its budget, then the technology is really helpful. Beyond pandemic, if we say, then we can think of other diseases like TB is a very big disease, probably in India also, in Haryana also, and other diseases. They also need technological inputs, which are, I'm sure, which are and which will come in due course of time. Technology should be in the hands of the people who know how to use them at the very ground level, at the very basic level, and then it should be strengthened up to the upper levels. The techniques and the trainings that how it is to be used, that should be very crystal clear. Since in COVID times we were dependent on e-training also, the physical trainings could not happen. So there also the e-conferencing or video conferencing played a vital role. Overall, I can think of that in future also, like we feel that and we hope that COVID will be over sooner or later. In future also, I'm sure that in healthcare, particularly in health department, in healthcare, there are many things which require latest technology, up to date technology, because still I feel that sometimes and at some places the technology used is totally outdated, and I feel that new technology, maybe that can be artificial intelligence based, or that can be digital technology is required, and sooner or later India will get it. Thank you. I stop here, and I once again thank APAC Health Tech Innovation Conclave for inviting me and giving me an opportunity to interact with such an august gathering. Thank you. Thanks a lot.
Thank you so much. Thank you so much, Mr. Prabhjot Singh, Mission Director, National Health Mission, Department of Health and Family Welfare, Government of Haryana. And you also rightly pointed out that the uh, accessibility of technology, again, affordable and sustainable, that has to be one of the most important part that has to be kept in mind. And the way things are changing during the pandemic and beyond pandemic, that will be the way forward to move in the right direction. Thank you so much, Prabhjot Singh, for joining us in the inaugural of HealthTech Innovation Conclave, organized by APAC News Network, presented by Dell Technologies and Microsoft. We also have the we also have Ogneto as the gold partner and Doxiva and Vivo as the associate partners. Thank you so much, Mr. Prabhjot Singh.